Hello, world. Welcome, I am your host Mr. Stag. Today we will be discussing CVS Health Corporation, ticker symbol CVS, one of the world's largest companies not spoken about. Before we get into the video, do not forget to like, share, and subscribe. CVS Health Corporation is an American healthcare company that owns CVS Pharmacy, a retail pharmacy chain, CVS Caremark, a pharmacy benefits manager, and Aetna, a health insurance provider, among many other brands. CVS Health is ranked 4th on the Fortune 500 list, and 7th on the Fortune Global 500 list. The company has more than 9,900 retail locations, approximately 1,100 walk-in medical clinics, a leading pharmacy benefits manager with approximately 105 million plan members, a dedicated senior pharmacy care business serving more than 1 million patients per year and expanding specialty pharmacy services. They also serve an estimated 34 million people through traditional, voluntary and consumer-directed health insurance products and related services, including expanding Medicare Advantage offerings and a leading standalone Medicare Part D prescription drug plan (PDP). The company believes its innovative health care model increases access to quality care, delivers better health outcomes and lowers overall health care costs. Nearly 85% of U.S. population lives within 10 miles of a CVS location. Consumer Value Stores, CVS, was founded in 1963 by three partners, brothers Stanley and Sidney Goldstein and Ralph Hoagland, who grew the venture from a parent company, Mark Steven, Inc., that helped retailers manage their health and beauty aid product lines. The business began as a chain of health and beauty aid stores, but within several years, pharmacies were added. In 1964, the chain grows to 17 stores. In 1969, seeking financial backing to support the further expansion of CVS, which had grown to 40 stores with sales of $20 million, the Goldsteins sold the company to Melville Corporation. To facilitate growth and expansion, the company joined the Melville Corporation, which managed a string of retail businesses. The original CVS logo is developed, CVS banner inside a shield, with the words, Consumer Value Stores below, and displayed on store exteriors for the first time. In 1970, CVS operates 100 stores in New England and the Northeast. In 1972, CVS nearly doubles in size with its acquisition of 84 Clinton drug and discount stores. This purchase introduced CVS to the Midwest with stores in Indiana. In 1974, CVS achieves $100 million in annual sales. In 1977, CVS acquires the 36-store New Jersey-based Mac drug chain. In 1981, CVS breaks ground on the Store Support Center in Woonsocket, Rhode Island. In 1983, hemophilia patient home health care is launched. In 1985, CVS reaches $1 billion in annual sales. In 1987, Stanley Goldstein takes over as chairman and CEO of Melville Corporation. In 1988, CVS Pharmacy celebrates its 25th anniversary, finishing the year with nearly 750 stores and sales of about $1.6 billion. In 1990, CVS acquires 500 stores from People's Drug, which establishes the company in new mid-Atlantic markets including Washington, D.C., Pennsylvania, Maryland and Virginia. In 1991, Caremark purchases Prescription Health Services (PHS). In 1992, Caremark spins off from Baxter. The Caremark formulary is developed and clinical intervention programs are introduced. In 1994, CVS launches PharmaCare, a pharmacy benefit management company providing a wide range of services to employers and insurers. Tom Ryan is named President and CEO of CVS Pharmacy. Ryan began his career with CVS Pharmacy in 1974 as a pharmacy intern. In 1995, Caremark launches Care Patterns disease management programs. In 1996, following the restructuring of Melville Corporation, CVS Corporation becomes a standalone company trading on the New York Stock Exchange under the CVS ticker. Stanley Goldstein is the company's first chairman. In 1997, CVS completes its acquisition of more than 2,500 stores from Revco, the largest acquisition in the history of the U.S. retail pharmacy industry. The acquisition of Revco gives CVS key drugstore locations primarily in the Midwest and Southeast. In 1998, CVS acquires 200 stores from Arbor Drugs of Michigan to bring its store total to 4,100 across 24 states. Caremark defines pharmaceutical services as its core operating unit and establishes a National Pharmacy and Therapeutics Committee. In 1999, Caremark launches online prescription refills. Tom Ryan is named chairman of CVS Corporation, succeeding company co-founder Stanley Goldstein. CVS announces plans to enter Florida, with stores initially planned for the Tampa market. CVS Pharmacy launches CVS.com, the first fully integrated online pharmacy in the United States. 1999, CVS acquired Soma.com, the first online pharmacy, and renamed it CVS.com to become the first fully integrated online and brick-and-mortar pharmacy offering to consumers. In 2000, Rick Krieger and partners Douglas Smith, MD, Steve Pontius and Kevin Smith, RN, FNP found QuickMedX, the retail health care centers that became Minute Clinic. CVS Corporation acquires Statlander Pharmacy, making CVS ProCare the largest specialty pharmacy in the U.S. at the time. CVS Pharmacy announces plans to enter the Chicago market and continue expansion in Florida with stores slated for Fort Lauderdale and Orlando. In 2002, CVS Pharmacy continues to grow, announcing plans to enter Texas with stores targeted for high population growth markets such as Dallas and Houston. The company's first locations in Phoenix and Las Vegas are also announced. In 2004, CVS completes its acquisition of 1,268 Eckerd stores and Eckerd Health Services, Eckerd's mail order and pharmacy benefit management business. In 2005, CVS Pharmacy partners with Minute Clinic, announcing 3 clinics to open in CVS Pharmacy stores. In 2006, Minute Clinic becomes the first retail clinic to be accredited by the Joint Commission. CVS acquires 700 standalone Sav-On and Osco drugstores from Albertsons, growing its presence in Southern California and key Midwest markets. CVS Corporation acquires Minute Clinic, America's leading operator of in-store health clinics. In 2006, CVS Corporation and Caremark Rx, Inc. complete their transformative merger, creating CVS Caremark, the nation's premier integrated pharmacy services provider. In 2008, CVS Caremark acquires 541 stores from Long's Drug in California, Hawaii, Nevada and Arizona, giving CVS Pharmacy immediate market leadership in Northern and Central California. In 2009, Minute Clinic begins a series of affiliations with major health systems across the U.S. to enhance access to high-quality, affordable healthcare services. CVS Caremark announces that it exceeded $100 billion in revenues in 2011. In September of 2014, CVS Caremark removes all cigarettes and tobacco products from its CVS Pharmacy stores and launches a national smoking cessation program. CVS Caremark announces that its corporate name has changed to CVS Health to further reflect its broader commitment to healthcare. CVS Health completes the purchase of Navarro Discount Pharmacy, the largest Hispanic-owned drugstore chain in the U.S. in 2015. CVS Health completes its acquisition of Omnicare, the leading provider of pharmacy services to long-term care facilities. CVS Health completes its acquisition of Target's 1,600-plus pharmacies and clinics. In 2018, CVS Health fights back on high-cost drugs by launching industry's most comprehensive approach to saving patients money. CVS Health completes acquisition of Aetna for $69 billion, marking the start of transforming the consumer health experience. CVS agreed to buy health insurer Aetna for roughly about $207 per share, broken down into $145 in cash and the rest in stock, in December 2017. This acquisition allowed CVS to provide a broad range of health services to Aetna's 22 million medical members. In 2020, CVS Health commits the full strength of the enterprise to focus on addressing the critical and urgent health care needs stemming from the COVID-19 pandemic. As a leader on the front lines, the company becomes America's largest private provider of COVID-19 testing, administering more than 15 million tests across 4,800 sites through January 2021, with an emphasis on addressing racial health inequities in Black and Hispanic communities. The company also contributes more than $50 million in philanthropic actions in response to COVID-19. CVS Health invests nearly $600 million over 5 years to advance employee, community and public policy initiatives that address inequality faced by Black people and other disenfranchised communities. In 2021, CVS Health begins administration of COVID-19 vaccines. In partnership with the Centers for Disease Control and Prevention, the company is one of the first to offer on-site COVID-19 vaccination services for residents of nursing homes and assisted living facilities across the United States. The company eventually offers COVID-19 inoculations at nearly 10,000 CVS Pharmacy locations. As of August, the company has administered 29 million COVID-19 tests and 30 million vaccine doses. CVS's current stock price at the time of this video is $100.90 with a market cap of $133.14 billion. The stock is currently undervalued according to Simply Wall Street by 52.4% with a fair value price of $211.77. The company has a P/E ratio of 17.6%. The company has a P/B ratio of 1.8, which is a good value based on the industry P/B ratio of 2.9. CVS currently pays a dividend of 2.2% and it has a payout ratio of 35%. The company has earnings per share of 5.74, a gross margin of 17.35%, a net profit margin of 2.67%, and a debt-to-equity ratio of 76.6%. CVS's hold on the pharmacy market effectively put a lot of mom-and-pop drug and corner stores out of business. Tell us what you think about the future of the CVS in the comments section below. Mr. Stag logging off.